compared to the past on what used to happen.
Wow.
Thank you.
Wow. It is really an eye-opener, a serious eye-opener. And we realize that even as a parent, you are busy, and therefore these are the things we just allow. If it's a phone, I leave it with my child. It becomes the caretaker of my child, and may God really help us. And maybe just on the same note, we realize that now in the current generation, we have so many health facilities. We have doctors who have opened their own clinics. We have dispensaries. We have hospitals, big ones up to even level 5, level 6. But yet when we compare with the past, where they could have maybe like you walk for a very long distance before you can get a healthy facility. Yet when you ask our elderly people, they will tell you like in the past, like morning was such easier because the death rate is so high. What is the missing link?
I'd say the missing link, I think it's our health-seeking behavior. We really want everything very fast, and most of the time you talk to people as, why don't you go to the hospital? They'll complain of the long queues at the hospital. They'll complain of the long procedures at the facility level. But I think we have a challenge with health-seeking behavior. We really want to procure over-counter drugs. You have a headache, you want to rush and get a Maramoja, get paracetamol at a chemist, without knowing that it is important to go for diagnosis, just to find out what is ailing you. So I'd say the missing link is our health-seeking behavior, which really we need to look at it. If I'm ailing, I'd prefer go and queue at the facility and know what is ailing me, other than just taking a shortcut and get drugs over the counter. I'll feel better for some time, but maybe it may be a bigger problem that may need to be relooked at.
And so are there any ways we can actually improve on this?
Yes, there are so many ways on how we can improve on this. As you said correctly, now we have so many hospitals. Basically in every ward we have a dispensary, we have a health center, we have a referral facility, and there are healthcare workers there. What I know, if something cannot be done, if a diagnosis cannot be done at a dispensary level, you'll be referred to a health center or even to a level 4 hospital. So what I want to tell this generation, let us improve on our health-seeking behavior. When you have a problem, speak out and get help from a facility. Let's stop going to clinics. Clinics are not bad, but let's stop taking shortcuts, because shortcuts will not help us. And then I'm also looking at, we have an insurance scheme, because you may tell people to go to the facility. Some of them will tell you, I don't have money, I'm not prepared, I cannot pay for an investigation. But we have a health insurance system, the NHIF. For our teenagers who are in school, I know we have an insurance scheme that is covering them, so long as you are in the NEMIS system. And also our adolescents who are going to college, I believe you can be covered as long as you prove you are in college. There's an insurance cover for that. So we should not fear going to the hospital. We should not fear seeking treatment whenever we are sick. And not only for treatment of diseases, even just for mental health, for counseling, for checkup. It is important to go for checkup. Target to be having a checkup at least once in a year. That is the minimum. Yeah, if you can afford to do that, just to check how your pressure is, how your sugar level is, check for HIV status. It is very, very important for us.
I don't know what we will do to ensure that that one happens. You know, sometimes you interact with a person and you're like, and someone is like, I'm just going to hospital and I'm not sick. You want them to discover an ailment that will give me pressure and I die.
Exactly.
So people will be like, if I don't go to hospital, I'll not know what is eating me up and I'll
be okay.
Wow. I don't know if you are one of the victims who, even when you just feel some joints, some headaches, you'll say, let me go and buy a L. This one looks like malaria. Are you a victim of the same? You have a headache and you rush for Maramoja or Soramoja. Today we have such a motherly advice that it is very, very wise. We just get to a health facility and we will be sorted.
Yes.
And now there is maybe to another concern. There is this, can I call it a monster called cancer? Once it is just mentioned, it sends chills to the families, it sends chills to people, maybe because they have witnessed maybe a cancer patient, maybe the financial dent that the family got themselves in, maybe the pain they saw this person go through. And now the question is, are there ways in which we can minimize the cancer cases in this generation?
Thank you for that question. It is really coming in timely when we are seeing a lot of cancers coming up. Even for the generation that had never experienced cancer cases, the teenagers, it is something that used to be known as a disease of the old. Yes, a disease of specific people. But looking at the trends currently, even young girls, young boys, as young as 14, 15, they are suffering from cancer. And it is a concern. And my thinking and in my view, the only way to prevent cancers is to go for a checkup. The only challenge with cancers, by the time you start seeing symptoms manifesting, that disease has reached an advanced stage. Initially, you will not feel like you have a problem. Initially, you'll be okay, you'll be moving, you'll be mobile. By the time now you start experiencing pain, you start experiencing vaginal discharge, blood, in cases of cancer of the cervix. You start experiencing difficulty in swallowing, in cases of cancer of the esophagus, throat cancer. You feel like that is when you go now to the hospital, you seek treatment, and by that time, the cancer has really spread, it has really reached an advanced stage. My advice to our viewers, as I had said before, it is important to be going for checkup. For instance, you have painful swallowing, or you have hyperacidity. Every time you eat, you get like you have hyperacidity. Most of us Kenyans, we have a tendency of diagnosing ourselves. You get hyperacidity, you say, mi niko na ulcers. I feel like I have ulcers. So if I take this, I feel bad. I think I have ulcers. I have this headache. I think I have malaria, like the way you've said. I have abdominal pains. I think I took something wrong. If I just rush for Flagyl, I'll be okay. So once you're seeking over-the-counter medication, once, twice, thrice, it must raise an alarm that something is not right. And that's why I'm saying it is important to seek treatment, to seek diagnosis. For some cancers like breast cancer, throat cancer, cancer of the esophagus, cervical cancer, there are cancers that can be managed when they are detected early. And for something like cancer of the cervix, I really talk about it, and breast cancer, they're among the #1 killer cancers in our women. You can go for early checkup. You can do screening, screening for cervical cancer. It is happening in our hospitals. It is free of charge. Most of our people, our youths, will feel like, how can I go just to the hospital and expose myself? So and so will see me, they know me. I mean, that and your health, which is more important. Actually, you'd rather see me, but I'm getting a service. I'm getting a surety that I'm okay. And if I have a problem, it can be detected early. So when you have a problem that is chronic, kindly seek help. Seek diagnosis early. We have these small clinics that we have that cannot really offer a diagnosis. So it is important to visit a facility that is well known. If it is a private facility, it is well known. If it is a public facility, most of them actually, even as low as a dispensary level, they are able to screen for some cancers. And where they'll not be able, they'll refer you for further diagnosis and further evaluation. So what I'll say, to stop the cancers, let us screen, let us prevent other than treat. And we can only prevent by screening and seeking medical attention as soon as possible. Yes.
Now, you know, you have talked about going for screening and this early diagnosis.
Yes.
And a viewer is concerned and say that sometimes you get several cases of practitioner that